Well, hi, this is Jay Arthur, author of Lean Six Sigma for Hospitals and the QIMacros. We're on page 183 of the Healthcare Data Guide, and we're looking at the number of complaints over thousands of visits. So we'd like to know a little bit more about complaints and what the performance of that is. So we can take this data, select that data with your mouse, go to the QIMacros, click on UChart, and it's going to say, is complaints the sample size? And the answer is no, because it's thousands of visits. Usually when you adjust these things, you have to go the opposite direction. And so here you can see we have an out of control point below here, and then we have some 2 out of 3 above, 2 sigma. And in the QIMacros, if you ever have a question, you can show the rule numbers that have been violated, or you can show the 1 and 2 sigma lines. And that'll give you some idea where your data is on this chart. And so that tells us we can count on like 1 per 1,000 visits, roughly. Now, if we come back, there's some additional data on page 36 of complaints and types of complaints. So we can go to the QIMacros and do a Pareto chart of that. And so here we can see the 2 biggest complaints are for pain management and respect. Those are 71% of the total. We could actually go in and start doing root cause analysis on how do we improve pain management and how do we improve respect. And ignore the rest of these, all right? Just ignore the rest of these. Those 2 are the big bars on the Pareto chart. And we could have one team look at pain management and another one look at respect. And that's how quickly we could develop an improvement project that shows what our complaint rates are and what they're complaining about. And then we could actually go grab a fishbone diagram and start putting in our head of the fish during 2016, pain management had accounted for 35% or whatever of the problem and was higher than desired. And so we could start to actually go create an improvement project just that quickly using this data from the Healthcare Data Guide.